people diagnosed? I know there's things like the blood sugar and AC1 levels.
Right.
Explain that to us.
Fasting blood sugar, meaning that you take your blood like they do in the lab, right? You go to the laboratory without having eaten anything for at least 8 to 10 hours before. A number between 100 to 125 is considered prediabetes. A number above 126 is considered diabetes. And anybody under 100 is usually that average person. So the A1C or hemoglobin A1C is an average of 3 months. So that looks back to kind of like a summary of where your sugars have been. And for a prediabetes, it's 5.7 to 6.4%. Anything under 5.7 is considered average, or I hate to say normal, but of the average person. And then above 6.5% is considered type 2 diabetes.
Okay.
Just to add on to that, when we ask people is there a family history, a lot of them say no. Right. But that was because years ago, a typical diagnosis for type 2 diabetes was a fasting of 140. So people with maybe blood sugars of 130 years ago really had diabetes but weren't even diagnosed. Like Angie said, we now have lower guidelines.
Okay. And what is happening in our body when we have prediabetes or diabetes? What change has occurred?
That's a very good question. For one thing, a lot of people think that prediabetes is not as bad as diabetes. And some patients will tell me, okay, I know I have prediabetes, but once the doctor tells me I have diabetes, okay, then I'm going to take it seriously. Well, that's not the case, because we know when you're diagnosed with diabetes, it's about 10 years of fluctuations in blood sugars. And that time, there's being damage done to the heart, to the blood vessels, to the entire body. So it's something, once you get the diagnosis of diabetes, I tell people, congratulations, this is great. We can really do a lot.
And now we can do something.
We can do, absolutely, this is fantastic. Rather than wait for the diagnosis of diabetes.